Hi everyone, I wanted to do a quick video to explain how I made the connection between the voice and the pelvic floor. It's a short story over a long amount of time, and it really comes down to realizing something was missing because my voice changed when I was pregnant, and then postpartum I was like, whoa, I can't do my job with my voice like this. And my job was talking all day as a therapist, but also gigging and moonlighting and, doing jazz gigs and singing in all kinds of places. And it just wasn't coming together. And so I started to question that and realized that my breath support, it was hard to sustain phrases like I used to. I didn't have those kind of big notes that I used to. And my voice was fatigued more quickly. And I was losing my voice at the clinic. Like, not great. Um, and it had nothing to do with like going out to a noisy restaurant and then shouting to be heard. It wasn't like that because I was already aware that those habits are bad. Chronic coughing and protracted shouting and speaking without amplification. I was already, if I spoke to over 10 people, I would use voice amplification. So I was already doing the whole speech language pathology, best practices for voice care, right? So it was more than that. And then I began to read some of the papers on diaphragmatic anatomy and the connection between what was called 5 diaphragms. And I don't have time in this video to go over it, but the point of that is I emerged with this kind of reassurance that I wasn't just a crappy PT, right? I wasn't just a crappy pelvic PT, that there was really something else missing, and that was the voice to pelvic floor connection. So I began to use my background. My first book was on medical therapeutic yoga. So, sorry, I'm holding the phone. It's a little shaky. My first book was on medical therapeutic yoga, and I had been using those techniques with success, but I also needed to add vocalization over the top of it. So I started to use Pilates and yoga that was pelvic physical therapy informed, but then doing vocalization work and more advanced diaphragmatic breathing on top of it. And it worked. Like, I'm not leaking from anywhere. Like, I don't have a diastasis rectus, abdominis. My prolapse is gone. Like, I feel better than before I was pregnant and 10 years younger. It was working, but I couldn't prove it other than to say, I don't have any of these things and I feel great. I can do whatever I want. My voice feels good. It's not wearing out. I can hit my notes until I got imaging. So about 4 years ago now, I got my first, that I still have the same unit, ultrasound imaging unit. So rehab ultrasound imaging, which means it's not so much diagnostic, even though you can see things diagnostically. It's about biofeedback. It's about looking and imaging my bladder, my lateral abdominal wall, imaging position of the bladder, the uterus, all kinds of things. I won't get too graphic in this little G-rated video, but you can measure all kinds of things, and then there's your proof. I can immediately see that the work that I have put in did pay off. The voice to pelvic floor techniques that I've been using for a while, a long time, on myself and then all my patients, and then teaching hundreds of therapists across the world in multiple countries, and I believe across 5 continents now. It works. It is not easy, and it's hard to learn online. It's really best learned in person. But when I got imaging, I had the proof. I had the proof that the bladder was doing what it's supposed to when I coughed or sneezed or sang, and it wasn't getting really overly pressed down. That downward pressure gradient that pushes, if you push the bladder far enough, it's going to leak. I wasn't having any of the abdominal low back SI joint issues. When I measured my lateral abdominal wall, the ratios looked good. So Imaging is the proof that voice to pelvic floor connection matters, and it does work, and it is a game changer. You don't have to be a vocalist to benefit from voice to pelvic floor PT. You just have to want a better voice or a better core and pelvic floor. And you know what? Who doesn't want a better core and a better pelvic floor? Because a better pelvic floor is better sexual function. A better core is I can do anything I want, right? You can do anything you want. I can horseback ride, snowboard, hike 10 miles, whatever you want to do. And I'm not a spring chicken. I'm 50. So this is just a little bit about how I got into voice to pelvic floor connection. I do teach a professional continuing education course on this now. I'm teaching it through Herman and Wallace. I'm about to teach some others in different places, but go check them out. I will put the website in the notes. And I also obviously do patient care. In fact, I'm looking at my watch. I need to leave now and go to my other office to provide some voice to pelvic floor care this afternoon in the clinic. So whether you're a patient or a professional, I can help. And it is my passion. I never thought I would be able to bring together my favorite things, physical therapy and the voice. But here I am, the voice physio now. And I love using yoga and Pilates, all the mindfulness stuff. I've edited and contributed to multiple books. I have my last one is a co-edited book with Dr. Joe Tata, and my book before that was on yoga. So love the mindfulness work. I've taught hundreds of therapists how to do that. So when I use voice to pelvic floor work, I'm not only doing imaging, I am also incorporating the mindfulness and contemplative science piece into it. And I'm also looking for drivers, systemic drivers, root cause. And that's the functional medicine part. So voice to pelvic floor PT isn't just imaging and mindfulness, exercises and stuff. It's about looking at systemic inflammation. Do you have trouble managing glucose? Do you have trouble with systemic inflammation? Do you have trouble with nutritional issues that are triggering an inflammatory response, or just making your gut feel like crap? No pun intended. If those are the cases and it's layered, right? Maybe you get chronic UTIs and you're a singer, There are all kinds of systemic drivers that drive voice issues. But I would say in most all voice issues and in pretty much all pelvic floor issues, I've been imaging this for years now, and in every person that comes in with a pelvic floor issue, they have a voice issue too. That their incorrect voicing is really negatively impacting their core to pelvic floor health, and vice versa. People will come in strictly to see me for voice issues, and immediately I need to image everything downstream, the respiratory diaphragm, the pelvic floor, everything, to make sure that it's not a contributing factor, and pretty much 100% of the time, it is. So if you're out there with a voice to pelvic floor issue, anything between, and I'm also ortho and manual therapist, so I also screen the jaw, the neck, everything, the orofacial area, all the way down to the pelvic floor and the hip, which includes the SI joint and the low back. So if you have any of those issues and someone's told you they're not related, they're wrong. They're related. Your intuition is right. Check out the link, garnerpelvichealth.com, and you can get to a lot of my other resources that are free. Some are paid, but many are free as well. You can find me on Instagram and YouTube at Dr. Ginger Garner. Peace, y'all, and keep a healthy voice to pelvic floor. Yeah?